Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on lung anatomy and physiology, each with 4 answer choices and detailed explanations. 1. Lung volumes and capacities. A 25-year-old athlete undergoes pulmonary function testing. The test shows a total lung capacity of 6.5 Vilto, a tidal volume TV of 500 milliliters, and a residual volume RV of 1.5 Lista. Which lung volume represents the amount of air that can be exhaled after a normal tidal expiration? A. Inspiratory reserve volume IRV, B. Expiratory reserve volume E, C. Functional residual capacity VARC, D. Vital capacity VC. Answer. Expiratory reserve volume. Explanation. ERV is the additional air that can be exhaled after a normal expiration, distinguishing it from tidal volume TV and residual volume RV. 2. Pulmonary circulation. A 45-year-old man presents with shortness of breath. Pulmonary function tests are normal, but his pulmonary artery pressure is elevated. How does the pulmonary circulation differ from the systemic circulation? A. Pulmonary arteries contain deoxygenated blood. B. Pulmonary arteries have higher resistance than systemic arteries. C. Pulmonary veins contain deoxygenated blood. D. Pulmonary veins drain into the right atrium. A. Pulmonary arteries contain deoxygenated blood. Explanation. Unlike systemic arteries, pulmonary arteries carry deoxygenated blood to the lungs, while pulmonary veins return oxygenated blood to the left atrium. Ventilation and perfusion, VQ, mismatch. A 65-year-old smoker presents with progressive dyspnea. A VQ scan shows high ventilation but poor perfusion in some lung regions. Which condition is most likely? A. Pulmonary embolism. C. Chronic bronchitis. D. Pneumonia. Answer B. Pulmonary embolism. Explanation. Pulmonary embolism PE causes high VQ mismatch because affected lung regions receive air but not blood flow, leading to dead space ventilation. 4. Surfactant and neonatal respiratory distress syndrome, NRDS. A premature newborn at 28 weeks gestation has respiratory distress and requires oxygen therapy. Which substance is deficient in this infant? A. Surfactant, B. Hemoglobin, AC carbonic anhydrase, D. Alveolar macrophages. Answer A. Surfactant. Explanation. Surfactant reduces alveolar surface tension, preventing lung collapse, atelectasis. It is produced by type 2 pneumocytes, increasing after week 35 of gestation. Lung compliance. A 70-year-old woman with emphysema has increased lung compliance. What is the primary consequence of increased compliance? A. Increased elastic recoil. B. Increased airway resistance. C. Decreased work of breathing. D. Increased residual volume. Increased residual volume. Explanation. In emphysema, loss of elastic fibers increases lung compliance, making lungs easier to expand but harder to recoil, leading to air trapping. 6. Airway resistance. A 30-year-old asthmatic patient experiences wheezing and dyspnea after exposure to pollen. Which part of the respiratory system contributes the most to airway resistance? A. Alveoli, B. Trachea, C. Medium-sized bronchi, D. Terminal bronchioles. Answer C. Medium-sized bronch. Explanation. Airway resistance is highest in the medium-sized bronchi due to turbulent airflow, whereas terminal bronchioles have the lowest resistance. 7. Pulmonary gas exchange. A 55-year-old man with interstitial lung disease has hypoxia, but a normal alveolar arterial AA gradient. What is the primary mechanism of his hypoxia? A. Ventilation perfusion mismatch. B. Diffusion limitation. C. Hypoventilation. D. Right to left shunt. Answer hypoventilation. Explanation. Hypoventilation, e.g. from restrictive lung disease, causes hypoxia with a normal AA gradient, unlike shunts or diffusion defects. 8. Oxygen hemoglobin dissociation curve, a climber at high altitude, has low PO2 but normal O2 saturation. Which adaptation occurs to help oxygen unloading in tissues? A. Shift of the oxygen hemoglobin dissociation curve to the left. B. Increased production of 2,3-BPG. C. Increased hemoglobin affinity for oxygen. D. Decreased respiratory rate. Answer B. Increased production of 2,3-BPG. Explanation. 2,3-BPG binds hemoglobin, promoting oxygen unloading in tissues, which is critical at high altitudes. Carbon dioxide transport. A 40-year-old man hyperventilates due to anxiety. What happens to his blood pH and CO2 levels? A. Increased CO2. B. Increased pH, decreased CO2. C. Decreased pH, increased CO2. D. Decreased pH, decreased CO2. Answer B. Increased pH, decreased CO2 stew. Explanation: hyperventilation decreases CO2, leading to respiratory alkalosis at pH. 10. Control of breathing. A 65-year-old man with COPD has chronic hypercapnia, but is still able to breathe. What primarily drives his respiration? A. Central chemoreceptors sensing CO2. B. Peripheral chemoreceptors sensing O2. C. Stretch receptors in the lungs. D. Cortical voluntary control. Answer B. Peripheral chemoreceptors sensing O2. Explanation: in COPD, chronic hypercapnia blunts the CO2 response. So hypoxia, O2 levels, becomes the main respiratory drive via peripheral chemoreceptors.